what I was thinking. Eventually, you guys will probably need hearing aids because we wear these IFBs in our ear all the time.
Yeah.
But don't worry, you would not believe how high-tech hearing aids are. In fact, they can be controlled by your smartphone.
Wow.
Tracy Forner, this is really interesting.
Yeah,
I know.
that's space science stuff.
It kind of is. Here to talk a little bit more about that and why you shouldn't ignore any hearing problems, we have Dr. Scott Sanders from BalanceMD. Good to see you this morning. And you brought a guest.
I did. With me today is Michelle Koley. She is an audiologist at our Indianapolis office, and she specializes in what we call vestibular function testing, which is simply a test procedure we do in our office to help tell us why someone might be dizzy, have vertigo, or balance problems.
Because if they're having that, it could lead to other bigger problems.
Right. So as an audiologist, she also specializes in hearing loss and fitting hearing aids. May is Hearing Awareness Month, and we have a special promotion going on at our office to help people better afford hearing aids. So Michelle's going to tell us about the latest hearing aid technology.
Yeah, I'll give you back your iPhone so that you can do that there.
Yes, so hearing technology has come a long way. The latest advancements include miniaturized devices, which are very inconspicuous. They also can be controlled by your iPhone, which is very nice. So I have a device in right now, which no one probably could even tell.
Teeny tiny,
very
you
small.
can't even see it.
I'll actually take it out so you can see. It's about the size of a nickel. Maybe,
at
if
best.
that, yeah.
Yes.
So very small, very easy to take in and out. They also are now easily controlled by your iPhone, some of the newest technology where we can adjust volume, change programs. Also, the hearing aids now have geotagging. So if there is an environment that you particularly have difficulty hearing in with traditional hearing devices, you now can custom set your hearing aid to the best user setting for that environment, whether it be a gym, a church, bridge club with friends, whatever, where you're having trouble, set it, and then from then on, anytime you get into that environment or that location, the hearing aid will automatically go to those personalized settings that you set based on how you were hearing that day. So it's all automatic now.
Absolutely amazing. I think for most of us, when we think of hearing aids, I think of something that my great-grandmother wore that was really big, you know, and you could hear it, like, Grandma, your hearing aid's buzzing, it's squeaking, I can hear it. But the point is, I think a lot of people, as you guys mentioned, sort of ignore hearing loss because, well, they just don't want to deal with it. They think it's an indicator that they're getting old. But there's a lot of bad implications if you don't address hearing loss. Let's talk about that briefly.
That is true. Hearing loss has been shown to cause lots of social, emotional anxiety, social isolation and depression, simply because if you're in a loud environment and you're not able to communicate with the conversation and feel a part of the conversation, you withdraw. And that can lead to that can cause you to have lots of negative implications on your social environment and social gatherings with people. Then now there's a new study that has been released that actually shows that hearing loss untreated can cause cognitive delay and lead to early onset dementia, which is not something that anyone wants to, aggressively cause to happen. You want to try to prevent it in any way you can.
Well, anything you can do to prevent that, anything that you can do to make sure that you're getting the most out of life and not missing out on something.
You don't want to miss your grandchild talking to you and their tiny little voice, and you don't want to miss big moments. So fitting hearing aids when you first notice problems is definitely the thing to do.
And okay, doctor, if somebody is suspecting that maybe they are having a hearing issue, obviously they should contact your office.